Hey everybody, it's Dr. Reiser. If you like what you see in our videos, make sure you click subscribe so that you don't miss out on any future videos about functional medicine, nutrition, and tips on how to reclaim your health the easy way with Functional Health Center of the Carolinas.
Hey everybody, it's Dr. Reiser, another Whiteboard Wednesday, and today we're going to continue on our discussion about B vitamins and breaking every single B vitamin down. Where are they found in foods? What do they do for your body? And the correct dosages for you guys to take them. Like I said in the first video, the number one thing I hear from patients is, do I need a B vitamin? Do I need Super B complex? Well, it's not as easy as just popping a Super B complex and hoping that that changes your health. We want to make sure we're taking the correct B vitamins for specific symptoms and for specific physiology that needs improved. So we're going to continue on with the next 3 B vitamins, and so those would be vitamin B5, B6, and B7 over here. These are going to be the ones that you probably start to recognize now rather than the first few vitamin Bs that we went through, especially biotin B7 here. Most people take that. So let's get into actually what these are, where you can find them, and what we will be using them for in any kind of treatment protocol. So first one, B5, pantothenic acid. You're going to use this for production of hormones and cholesterol. So if you're deficient in vitamin B5, you won't have enough cholesterol and therefore won't have enough hormones to function properly. Now, I'm not saying that this deficiency will for sure cause this, but having a deficiency in vitamin B5 is not doing you any favors when it comes to proper cholesterol production, proper hormone production. And as we know in people, we see, especially as we age, when cholesterol goes low, we tend to have brain problems, we tend to have memory and cognition problems, energy problems, and then therefore hormone problems. You're not able to make your testosterone and your estrogen. So vitamin B5 is important in this because it breaks down these fatty acids that will promote and encourage production of hormones and cholesterol. The other thing, obviously, when we're talking about cholesterol and we're talking about hormones is, if you are deficient in vitamin B5, you typically have a higher risk of developing stroke and heart attack. So if we take vitamin B5, or if we know we're already at a higher risk for stroke and heart attack, taking vitamin B5 will help decrease your risk. And obviously that's mostly because you're going to be regulating hormones and regulating cholesterol at a better level. Foods you can find this in would be your beans, your meats, your broccoli, mushrooms, potatoes, tomatoes, all have high B5 levels, so incorporate those in your diet. And as far as the dose that you want to get, make sure you get 5 milligrams daily at least. Now remember, again, as I'm going through these, one patient pointed this out, these are recommended daily values. So these are not therapeutic doses, these are just recommended daily values. Therapeutic doses we would have to take on a case-by-case basis, but these are going to be the amounts you want to get in daily as just a normal intake of this vitamin. Next vitamin, we're going to talk about vitamin B6 now. So vitamin B6 is one that I use a lot in practice because it definitely helps with blood sugar regulation, healthy nerve function. And so these two, if we break them down, especially the blood sugar situation here, they found in a study, multiple studies actually, that if you have a deficiency in B6, and they did these in laboratory mice, a deficiency in B6 would promote type 2 diabetes in these animals. So regulating blood sugar is important, and B6 will help you do that. So we find time and time again that our type 2 diabetics or our pre-diabetics, people with blood sugar regulation issues, have problems with B6 being at an adequate level. Similarly, the patients that we have with nerve function issues, whether it's neuropathy in the feet, issues with memory and cognition, B6 deficiency once again pops up. So this is a very important B vitamin, one that we see time and time again as far as a deficiency. So we want to test for that. We do test for this one frequently. And low levels are also commonly found in patients with depression. So anytime we have somebody come in and we do a hormonal test, the one hormone test we use, and I've talked about this before, the Dutch test, it includes an organic acids test testing for vitamin B6 deficiencies. And you'll see this a lot of time with people that have mood issues or depression issues. Now, once you figure that out, then you have to investigate, why do you have a vitamin B6 deficiency? But if you're somebody that's kind of depressed or have mood issues, maybe that's something we want to talk about as far as testing. Let's test your vitamin B6 levels. So where can you find this if you want to introduce more into your diet, see if this makes an impact with your health? Fish, beans, as per usual. Chicken especially has high vitamin B6 levels, squash, onions, bananas, and then of course your nuts and your seeds. As far as a recommended daily value, dose yourself at 1.5 micrograms daily. And watch with B6. This is one that can become toxic, so don't dose very high. In fact, let your practitioner dose you. Last but not least is biotin. I'm sure everybody, especially the females that are watching this, have taken biotin at some point because it helps with hair, skin, and nails. And the funny thing about this is, I'm going to put this up on the whiteboard. It's going to appear here. There are very few studies that actually support this. So this isn't a foolproof plan to get your hair, skin, and nails to grow better. Typically, you want to look at things like cortisol, thyroid, iron deficiencies, things like that. Amino acid deficiencies, carnitine would be one of those. So don't fully push the biotin thing, but it does work with B5 to break down fats. And as we know, B5 is breaking down fats to help with cholesterol and your hormone regulation, so B7 will be involved in that as well. Studies show it helps blood sugar in type 1 diabetics, so here we go again, more blood sugar regulation. And this is something that if you do introduce biotin to type 1 diabetics, they seem to have a better handle on their blood sugar regulation. Where do you find B7 as far as biotin? Eggs. Here we go again, popping up eggs. Don't be afraid of eggs. I say this in every single video that we talk about eggs. The cholesterol is not going to get you. Eat your eggs in the morning. You'll get several B vitamins. Add in some tuna, some salmon, and then especially sweet potatoes and broccoli have high B7 biotin levels. And if you want to dose yourself with some biotin, 30 micrograms daily would be an appropriate dose for a recommended daily value. So there's our 3 B vitamins. In the middle here, we're going to finish up with the last 2 B vitamins next week. And obviously we're all waiting for B12. Yes, we will discuss that in depth, what we should do as far as dosage and how we should take it. But these are 3 very important B vitamins as well. So if you're feeling any type of way, if you have problems with cholesterol regulation, if you have problems with hormone regulation, mood issues, cognition, if you're at high risk for heart attack and stroke, start to get some vitamin B5 in, start to get some B7 biotin in, and introduce these vitamin Bs because it will definitely help you. But the one thing you should definitely do is get tested, like I said in the first video, get yourself an organic acids test to see if we have an adequate level of B vitamins, or a micronutrient test, which is what I would prefer you do, looking and seeing what's floating around in the bloodstream. Do we have an adequate amount? And then dose yourself therapeutically, and then introduce some of these foods into your diet. So thanks, guys. Look for the next and final one in the vitamin B series next week. After that, we'll get back to our regularly scheduled program, diving into different things. So if you want to see a Whiteboard Wednesday about your question or something that you have health-wise, a symptom or something physiologically going wrong, and you want to see it in a Whiteboard Wednesday, DM us or email us, and then we can pop it up and go in depth on something that you care about or a family member cares about. So have a great week, everybody. See you next Wednesday.